welcome to the AANEM Neuromuscular Fellowship Fair. We have 4 programs presenting for you tonight. So we have Case Western Reserve University, University Hospital Cleveland Medical Center, Cleveland Clinic, Ohio State University Hospital Program, and University of Cincinnati Medical Center. So each program will give about a brief 10-minute presentation, just kind of introducing their program and about their fellowship. And when all of the programs have completed the presentations, we will jump into a question and answer period. We will utilize the chat feature for that. So if you have a question during any of the presentations, feel free to put that out there in the chat. We just won't be answering anything until the very end. All right, so without any hesitation, let's go ahead and get started. Thanks again for joining us.
Thank you so much for having us. So I'm Komal Savlani. I'm from University Hospitals Case Western Reserve University in Cleveland, Ohio. And I'm going to tell you a little bit about our program. So our faculty is made up of about 8 different faculty. We have Dr. Bashar Katurji, who's our program director, also our division chief, our EMG lab director, and helps to co-direct our ALS clinic with me. There's myself, I'm Komal Savlani. I'm the associate program director of our fellowship, and I help to direct our adult SMA clinic as well as our co-direct our ALS clinic. There's Dr. Barbara Shapiro, Dr. Chris Geiger, who also is one of our neurology residency directors, and Dr. David C. Preston, who also helps as our director of our neuromuscular ultrasound laboratory. Then we have Dr. Daniel Miller, Dr. Merrick Buchek, and Dr. Mark Cohen. Dr. Cohen is our neuropathologist and so is heavily involved in helping our fellows learn nerve and muscle pathology. We have 7 EMG technicians who are all involved in teaching EMG, autonomic technicians, and the fellows also interact a lot with our 3 main neuromuscular secretaries and our 2 nurses. One thing to know about our fellowship program is that amongst our faculty, we have leaders in neuromuscular medical education. Some of the textbooks you see here are used often in learning neuromuscular medicine as well as EMG. The blue textbook is one of Dr. Katurji's books. The red one is Dr. Shapiro and Dr. Preston's book that is often used to learn the basics of EMG. And then the black book is a case-based approach to learning EMG, which is also Dr. Katurji's book. Our faculty help to lead sessions at the AANEM, and certainly our fellows often will get involved in the AANEM as well, attending it and also being a part of different presentations, poster presentations, cases there. They've been invited as professors to other institutions. And that spirit of medical education continues with our fellows. So our neurology residency program is built such that in the 3rd year, the residents do an 8-week EMG rotation, and the fellows are active educators in helping our residents to learn the basics of EMG during that time and give lectures. Our fellowship is a 1-year ACGME accredited fellowship. It's comprehensive in the sense that we cover all the procedures of neuromuscular medicine, as well as see a diverse patient population. It's a very collegial atmosphere, and there's a lot of emphasis on the faculty for being educators, in addition to doing some research. Our major site of training is called University Hospital Cleveland Medical Center. It is our tertiary care facility of our University Hospitals network. And we have 2 to 3 ACGME positions per year. We always have 2 funded positions, and if we are able to, we try to get a 3rd funded position as well. Our clinics include seeing patients in a general neuromuscular clinic, muscle disease patients. We have an ALS multidisciplinary clinic, adult SMA clinic, pediatric patients, patients with neuropathy, neuromuscular junction disorders, and autonomic patients. And here's a picture of actually one of our fellows, Dan Benson, in our workroom. Our main hospital is the main site of training. Our clinic space is in a building called Bowell Building. but the fellows do rotate at 2 other main satellite locations called UH Chagrin, Minoff, and UH Suburban, and they are about 20 to 27 minutes away from our main hospital. In addition, our ALS clinic is done at a place called Foley Elder Care. We also run a neuromuscular inpatient consult service, and the one unique thing about our hospital system is that it's actually a conglomeration of several hospitals in one, which means that you get to see a very diverse patient population when we're doing our neuromuscular inpatient consults, and also when these patients get referred to us in clinic. So there's 2 adult hospitals, a women's hospital where our labor and delivery patients go, a cancer center, and a Rainbow and Babies Children Hospital. This picture here is the front view of our hospital. So on the left-hand side is the Seidman Cancer Center, which is connected to our main hospital. A cornerstone procedure of any neuromuscular fellowship is learning EMG, and we are an AANEM accredited lab. We have a robust didactic curriculum. So at the very beginning of the year, starting off in July, through the next couple of months, we actually spend quite a lot of time going over the basics of EMG, artifact. We teach in a one-on-one apprenticeship style method. We have 9 EMG rooms across 4 different sites. And then the other things that the fellows get to learn are single fiber, how to do blink reflexes, repetitive stimulation, F waves, and H reflex. And here's a picture of one of our EMG labs. We also are very fortunate to have developed a robust and comprehensive neuromuscular ultrasound curriculum. As part of this curriculum, we have hands-on quizzes and workshops, and we are lucky enough to have 4 ultrasound machines across all 3 procedure locations where the fellows work with us. At the top here is a picture of one of our ultrasound machines and one of our fellows using that. And on the bottom here is Dr. Preston doing an anatomy review as part of one of our didactic sessions for ultrasound. We also have an autonomic laboratory, actually at 3 locations where we have tilt table testing, thermoregulatory sweat testing, and we also do skin biopsies for workup of small fiber neuropathy. Here at the bottom is a picture of our thermoregulatory sweat testing, and on the right-hand side is a tilt table. And then the other procedure that we teach the fellows is called forearm exercise testing. We have a comprehensive didactic and conference schedule. Tuesday afternoons are for neuromuscular topics. So we talk about, most recently we've talked about vasculitis, neuromuscular junction disorders, muscular dystrophies. And then on Wednesday afternoons, we do a rotation. So we have journal club, case conference, research discussion, and we also do our muscle and neuropathology session with Dr. Cohen at that time. And as a part of that, there's also a dedicated neuropathology curriculum that we design each year. The fellows also attend neurology and neuromuscular grand rounds, as well as an EMG quarterly quality conference. The fellows are involved in teaching, as I mentioned before, for our neurology residents who rotate through the EMG rotation. They also are part of the Case Western medical student case-based learning lectures. Their official title is that of a facilitator, and that happens maybe about once to twice a month. They also help to teach during our annual EMG Tech Education Conference. So most recently, our fellows have taught topics like how is ultrasound helpful for when we see certain things on EMG, reviewing repetitive stimulation with the text, for example. And then most recently, over the last couple of years, our fellows have had the chance to also teach at our physical therapy, occupational therapy, rehabilitation department conference as well. The week at a glance for our fellows involves each rotation lasts for about 4 months. And in 1 week, it's a combination of different neuromuscular clinics with different attendings. Procedures, there's always EMG, but some rotations have more time dedicated to ultrasound versus others. They do skin biopsies with us about once a month. But throughout each rotation, there's an emphasis on continuity of care. And so if a fellow has started seeing a patient with us on inpatient consults, we want that fellow to continue seeing that patient with us through our clinic. And there's enough overlap that we can make that happen. All of our trainings are together for teaching and didactic sessions. And then the neuromuscular inpatient consultation service is just typically 1 to 2 consults per week. Some weeks are without consults, and each fellow is on that rotation for 4 months in addition to their outpatient schedule for that time. One thing that's nice about Cleveland Medical Center is that we have a diverse patient population. So we get patients from Northeast Ohio from a variety of backgrounds and socioeconomic statuses. We get patients from our neighboring states, and that's very helpful as well, because our main hospital is that conglomeration of several hospitals, so we get to see a diverse patient population for that reason as well. For those of you who haven't been to Cleveland before, it's a great city to live in. It's the best of living in a city. It's small enough that it's easy to get around, but all of the things that you like in a city are in it. So some highlights are our Playhouse Square, where you can watch Broadway plays, the Cleveland Orchestra, museums, including the Cleveland Museum of Art, which is one of our, which is one of the top art museums in the country. We are right next to the School of Medicine, so just down the street from it. Our main hospital is on the Case Western campus, and that comes with a lot of perks. The area around the hospital is called University Circle, and this is where we have the museums. It's affordable and easy to travel around. After fellowship, our fellows go on to do a variety of different things, leaders in the region and internationally. And here's just a quick list of some of the things our fellows have done. So you can see some of them go on to become, to do other fellowships that are related to neuromuscular. Two of our 3 current fellows are actually staying here in Cleveland and have positions lined up at Metro Health, which we're very excited about for them. All right, so that's an overview of our program. If there are questions, please feel free to ask them at the end. And here's our contact information. Thank you so much.
Hello, everyone. My name is John Marin, and I'm the Program Director for the Cleveland Clinic Neuromuscular Medicine Fellowship. It gives me great pleasure to tell you all a little bit about our program. First of all, our institution, the Cleveland Clinic, actually is celebrating its 100 year, so we are celebrating a centennial year this year, and it causes us to do some reflection. And here we are reminded that our founding members thought it was important enough to put education very much front and center in our mission. The original building had on its wall etched in there the following statement: care for the sick, investigation of their problems, and further education of those who serve. So we do take pride in this great legacy in creating the optimal learning environment for who we really believe to be future leaders in our field, and that includes neuromuscular medicine. All right, more about our neuromuscular program. So we are a 1-year program that's ACGME accredited, and we have 3 positions available per year. So we're also one of the few programs that have a very wide range of subspecialties within the neuromuscular field represented in our staff, and we also have a large number of staff. We have 10 full-time staff physicians. We also have high volume and great diversity of patients. We see over 400 inpatients here, at over 13,000 outpatients in the neuromuscular field and within the neuromuscular center. We perform over 4,000 EMGs annually as well. Under the umbrella of the Neuromuscular Center, we have a comprehensive autonomic disorders lab, a skin biopsy and histopathology lab where we do evaluations for small fiber neuropathy, and we have an ever-expanding service line for neuromuscular ultrasound. A little bit about how the fellowship year is structured. So the first month, so the month of July, it's heavily lecture and didactics based. We cover basic clinical neurophysiology, focusing of course on nerve conduction studies and EMG. And there is a lot of deepening and widening of the knowledge base in neuromuscular anatomy and histopathology, as well as clinic disorders before you step out into the clinics seeing patients. That starts in August. After that, you spend roughly about 50% of your time as a fellow in clinics, and these clinics are of different types. You have adult neuromuscular clinic. The vast majority of your experience will be that, but you'll also be having rotations in pediatric neuromuscular clinics, as well as the ALS multidisciplinary clinic. And there will be some inpatient exposure on the floors, as well as the ICU, where we perform subspecialty neuromuscular consultation services. Those are particularly important and helpful for you to see how acute neuromuscular challenges are managed. About 30 to 40% of your time is spent in the EMG lab, ramping up skills with nerve conduction and particularly needle electrode examination. People ask about what pediatric neuromuscular experience they may have, and this is provided through rotations at Metro, the Metro MDA, as well as through an affiliation we just forged between us and Akron Children's Hospital. The remainder of your time is spent with neuromuscular pathology, and we have two great neuromuscular pathologists. Of course, there's also time allotted for research and scholarly activities. Other opportunities include the ability to ramp up skills in neuromuscular ultrasound, skin biopsies, epidermal nerve fiber evaluations under the scope, autonomic studies, and single fiber EMG. There are some fellows in the past who have expressed interest in Botox injections and applications that may cross over into the neuromuscular field as it pertains to chemodenervation, and we've been able to facilitate those learning opportunities as well. Trainees may expect to perform between 400 and 500 plus EMGs during their training year. And it's not just quantity, it's quality, because we do have a wide range of neuromuscular pathology that comes through the EMG lab. So you get a skill set with not only difficult cases, but cases that are sometimes hard to find in other areas of the country. Of course, under the guidance and supervision of our distinguished faculty, throughout the year, our fellows see growth and proficiency increase in their clinical neuromuscular skill set, in the evaluation, workup, and management of various neuromuscular disorders. Part of the diversity we see in our patient population here in the Neuromuscular Center has to do with multiple pathways feeding us, and because the Cleveland Clinic as an institution has multiple sites, not only within satellites in Ohio, but out of state. So we have the Cleveland Clinic in Nevada and in Toronto, and we even have international sites that send us patients. We have Cleveland Clinic in Abu Dhabi, and new in 2021, as part of our centennial celebrations, we're happy to announce the opening of Cleveland Clinic London. So again, we have a unique opportunity here because of patients potentially being fielded from all over the world. And adding that to your repertoire actually is one of the most enriching parts of the fellowship experience here. We have several conferences as part of the scholarly activities done here. On a weekly basis, we have a very esteemed Grand Rounds presentation. And then on more of a monthly basis, we have several other offerings. We have the Neuromuscular Medicine Grand Rounds, and we have EMG and Neuromuscular Medicine clinical case conferences, as well as a monthly Neuromuscular Medicine Journal Club. Apart from those, we also have other opportunities for learning through special sessions, and these include supplementary lectures that the staff give. On a monthly basis, there are also high-yield EMG cases that are reviewed with Dr. Levin. He has a collection of these, and they're a great substrate for learning. And there are these potpourri sessions that we do, myself and faculty, to supplement, any perceived deficiencies or needs to learn more, have a greater depth of understanding for certain neuromuscular topics. I could say that also is a springboard for us to identify the areas that we need to focus on for in-service and board exam preparations, and I do some dedicated sessions with the fellows for that purpose. Fellows have the opportunity to teach. We also like to develop the clinical educator potential in our fellows, and they do this with opportunities to work with medical students from our medical school if they choose to do so, and certainly they have didactic assignments for the course that our neurology core program residents rotate through. So there's always opportunity to grow the teacher in us through those experiences. Fellows also participate in quality and patient safety projects among other neuromuscular medicine seminars that they present under the guidance and help from faculty. Our fellows have been very productive in research, and we have a research mentor pairing program, and we support them through their projects with statistical help, and we've been able to actually, I'm happy to say, publish in high impact journals, so there's a smattering of them there for you to see, and that's just looking at the last few years. So we've been able to be very prolific from the research standpoint, and that's been a strength of our program. Well, as you could see, we have faculty that are not just plenteous, but also of different niche and subspecialty careers, and these serve to help guide fellows who may have a particular interest in pursuing, let's say, motor neuron disease or autonomics or heavy neuromuscular ultrasound in their practice. So these subspecialty areas represented by the various faculty has been another strength of our program throughout the years. We have faculty that are also diverse in terms of their stage of career. So the diversity brings with it a great appeal. And we could definitely talk more about that during the Q&A session. That the city of Cleveland has a lot to offer, I think, for everyone. So, if you are somebody who steeped in history, culture, and the arts, cuisine, and entertainment, we're a place that would definitely meet and exceed your expectations. And that's a view from the fellows room on the west side of the building.
Hi, everyone. Thank you, actually, for spending the evening with us today. My name is Bakr Sheikh, and I'm one of the neuromuscular neurologists at the Ohio State University in Columbus, Ohio. And I want to spend the next 10 minutes or so to tell you a little bit about our neuromuscular medicine fellowship program. So the neuromuscular division at The Ohio State University was actually established early in the 1970s by Dr. Johnny Mandel. And as you know, Dr. Johnny Mandel was really one of the essentially godfathers of neuromuscular disease in the country. And prior to the ACGME accreditation of our fellowship, a lot of the top-notch neuromuscular neurologists in the country have trained at The Ohio State University. To name a few, Dr. Tony Amato, Dr. Rick Barron, Dr. Matt Wickland, and as well Dr. John Kissel. John Kissel took over the fellowship in 2007 after its accreditation, and he was the program director until his retirement around a couple of years ago. One of our very fellows was Mark Frante, one of the very first ACGME accredited neuromuscular fellows, just to give you an idea about the caliber of the fellows that goes through the OSU program. And so you can see the program aims, and I think the biggest thing about the program is that we do have a high quality clinical exposure, very robust clinical program. And our goal is to complement that with a very strong didactics, with the idea to provide the fellows with all the tools that they need to go into academia or to go into practice. So quickly at a glance, and so we do have two slots for the fellowship, one for an adult resident and one for a pediatric resident. And this is actually one of the very strong things as well about our fellowship is the program is, although it's, you have two arms to the program, one at the Ohio State University Wexner Medical Center, which is, this is our main adult hospital. And we do have the Nationwide Children Hospital, which is in the other side of town. It's like 10 or 15 minutes drive between the two campuses. So that's what we've done. And so there is collaboration between the two sites, and our fellows spend time in the two locations. So during the fellowship, so all our fellows will complete a QI patient safety project. They're engaged in a scholarly activity, and that's usually a research project. They're expected to attend one of the national meetings, and we help them attain that. It's usually the AAN or the AANEM, but according to the interest. So sometimes some of the fellows do attend some of the specialized national meetings, like the FSHD Society meeting, the QSMA meeting, the Muscle Study Group, and so on. Obviously, the fellows do the in-service, and we work with them to make sure that they're logging their hours and their procedures. Let me tell you quickly about our clinic schedule. And again, the clinics are in one of the two spots. So we have clinics in the main hospital, and we have the clinics at Nationwide Children. Actually, the majority of the clinics are actually multidisciplinary clinic, as I will show you later, the members of the team who participate in those. So as an example, we have an MDA clinic on Monday that's heavy on muscle, as well as CMT. We have our myasthenia gravis clinic, and that's on Tuesday. And we have our ALS clinic on every Thursday morning, our adult SMA clinic on Friday. And again, most of those clinics are actually multidisciplinary clinic with multiple faculty, as well as supportive staff working in those clinics at the same time. So there are also general neuromuscular clinic that are per different faculty. Similar in nationwide, we do have multiple multidisciplinary clinic. They do have MDA clinics as well as SMA clinic. And those are some of the clinics that the adult neurology residents will actually attend as well. So our main EMG lab, and this is really what most of the fellows training is, the lab has 5 rooms and it does run by 3 techs at the time with 2 faculty. That same location have our autonomic lab as well as the neuromuscular ultrasound service. So for the pediatric EMG, that happens on Friday at Nationwide Hospital, and actually with the faculty over there, Dr. Jen McKenna and Dr. Megan Waldrop. So we do have a weekly neuromuscular pathology conference, and that's actually also a combined conference between the faculty at Nationwide and the faculty at OSU Maine, and most of those activities are actually transmitted electronically, so they're virtually, and you could be attending the conference at whatever location you are at that day. So we require at least 4 weeks of inpatient EMG and neuromuscular consult, and during those you will be working with 1 or 2 attendings one-to-one, and so usually there is 1 attending who's covering the whole hospital inpatient EMGs and all the neuromuscular consults to allow enough exposure for acute neuromuscular pathology in those settings. We do have a heavy didactic program. We start the year by a 2 months of introductory lecture series and on EMG and neuromuscular clinical approach for the different case scenarios. We end that by our myology course. The myology course is a national course that's run under the umbrella of OSU. It's primarily held at Nationwide Children with contribution from the faculty at the main hospital. And this course will invite fellows from throughout the country, usually around 50 fellows, and we'll have a speaker from both nationally and internationally. It's a week heavy neuromuscular disease review course, and it really gets scored very high. So after that, the usual weekly activities is Monday morning, we have our neuromuscular conference. The presentations are kind of balanced between the faculty and the fellows. We usually try to limit the fellow to present only once a month because they do have their other reading commitments. And during the neuromuscular conference will include case reviews by the faculty, case conferences by the fellows. We also have topic reviews and topic updates by the faculty, and we also invite speakers around once a month from outside the institute or from within the institute outside our division for relevant topics. Tuesday morning is our main grand rounds. Thursday morning, we always have our didactic book, and we go over 2 books through the fellowship. One is the Preston and Shapiro EMG book, as well as Tony Amato Neuromuscular Diseases or Disorders book, and this is reading assignment, and then one of the faculty will make sure that the fellows got the start of the chapter. So we have Neuromuscular Journal Club done at Nationwide Children. This is around 2 to 4 times per month. Also, there is every other week, like twice a month, a neuromuscular pathology review session. The neuromuscular pathology review session is done by Dr. Kevin Flanagan, and those are just meticulous ways of going over pathology slides. We have, after our EMG get-together wellness journal club around dinner, and that's usually 2 to 3 times a year. Obviously, we haven't had some with the COVID this year. So in May, we have 3 or 4 of the faculty do a board review session, kind of focused review. As part of the weekly program, every fellow will have half a day for education and research to allow them to keep up with the studying and keep up with any research commitments. So here is introducing the faculty. This is our neuromuscular division. Dr. Miriam Freimer is the director of our division, and you have faculty with great national reputation, and everybody have a different niche. Dr. Dave Arnold, he also ran a basic science lab, and his clinical interest is actually SMA and the channelopathies and myotonic dystrophy. Dr. Chad Hoyle is actually our residency program director, and his research interest is in Friedreich's ataxia. Steve Kolb and Adam Quick, they run the ALS motor neuron disease clinic. Sam LaRusso works mostly on FSHD research. She also run the help with the amyloid clinic. That's also a multidisciplinary clinic that we run with the hematology. Dr. James Lee and Pete Robinson are run neuropathy clinics. So we work again, as I said, in a multidisciplinary setting. So we have 2 nurse practitioners, we have 2 nurses. Currently, we have 1 nurse. We have a physical therapist, a respiratory therapist, a social worker, and a genetic counselor, a dietitian, and a pharmacist. And all of those are within our, they work as part of our division. And so it's easy to work with them during your multidisciplinary interaction and multidisciplinary clinic. We have a large research operation as well. We usually run over 40 clinical studies, and we do have a very robust and a strong research team. So our colleagues at Nationwide Children, Dr. Ann Conley, she is the division chief, Dr. Kevin Flanagan, Dr. Jerry Mendel, and Zorif Sehank, as well as Megan Waldrop. And fellows interact with them during the clinic, interact with them during the neuromuscular journal club, as well as the neuromuscular pathology review. Here is our current fellows and some of our recent fellows. One of the things that at Nationwide Children, there is also the opportunity to do gene therapy fellowship, and many of our fellows, they sometimes spend an additional year to do the gene therapy fellowship. Renata Knox is now actually completed her fellowship last year, and now she is doing her gene therapy fellowship. Megan is actually joined as a faculty. Mike Esford is going to be joining us as a faculty, and Sam have multiple job offers. He is deciding to which one to choose. So this is Ohio State. Columbus is really a very nice and easy to mitigate city. It's really a college city. One last thing to say about our fellowship is we're really flexible in terms of the program. As long as somebody is meeting their requirement, we are, if one of the fellows need to spend more time with single fiber EMG or neuromuscular ultrasound, or they want to spend more time with needle biopsies or skin biopsies, we can definitely accommodate that. Here is my email, and Karen Willman is the program coordinator. And thank you. And if you have any questions, please feel free to email us.
Thank you all for being with us today. I'm Hani Kushlov. I'm the director of the fellowship program at University of Cincinnati. I'm not gonna make this a very long presentation. I will give you the high points of the fellowship and hopefully persuade you to apply for our fellowship program. So I have my email there and the coordinator's email and the web page if you want to know more information about the program. I thought I would start by saying congratulations for all the trainees who are choosing neuromuscular. A very exciting field. I think my colleagues who are with us, I'm sure they would agree. The field is exploding with progress. You will never be bored. You will actually have a difficult time keeping up with the progress in the field. So general information about the fellowship. Our goal is to produce at the end of the fellowship a well-rounded neuromuscular medicine subspecialist who would be able to practice either in an academic place or in private practice. The fellowship is ACGME accredited. It's a 1 year, and we take 1 fellow per year. The locations where the fellow train include the Medical Center, the Neuroscience Institute, Cincinnati Children's Hospital, and the Veteran Affairs Hospital. It includes inpatient and outpatient training, and at the end of the fellowship, you'll be able to sit for the Neuromuscular Medicine Board exam from the ABPN and also the American Board of Electrodiagnostic Medicine Board exam. So the training, the clinical training includes outpatient and inpatient. Inpatient includes neuromuscular consults and EMGs. The outpatient training, the fellow will have a continuity clinic, but in addition to that, they will rotate through general neuromuscular clinics, the adult and children MDA multidisciplinary clinics, the ALS multidisciplinary clinic, and will do a lot of EMGs, including single fiber EMG, and get trained in ultrasound. Our fellows typically do more than 800 EMGs per year. That's a large number of EMGs. You will get exposure to autonomic testing, and you will do skin biopsies. Of course, the content of the fellowship can always be geared to the interest of the fellow. In terms of weekly didactics, we have neuromuscular lectures, we have neuropathology slide review and neuropathology conferences. And the neuropathology conferences, typically these are designed so whoever of the neuromuscular faculty had a muscle or a nerve biopsy done in one of their patients, we will meet together with the pathologists that include myself, and we will go over their clinical presentation and take it from the clinical scenario down to the muscle or nerve biopsy, and hopefully come up with a diagnosis and treatment plan. There is also a Neuromuscular Journal Club, case conference, and the neurology grand rounds. The faculty that you would be trained with include myself, who I have pathology training, so I also look at nerve and muscle pathology. I do neuromuscular ultrasound, I do single fiber EMG, I do everything, but the rest, I direct the MDA clinic, I direct the neuromuscular research. My colleagues, we have Dr. Quillen, who is the division director. We have Dr. Neal, who's the director of the ALS clinic. Dr. Sams, she is the VA neurology chief, and when you rotate with the VA, you'll be working primarily with Dr. Sams. We have Suishia Tien, and she is the director of the Neuromuscular Center at the Cincinnati Children's Hospital Medical Center. And Jonathan Smith and Joe Wang, they're newer to our division, and both of them do neuromuscular ultrasound and are interested in just general neuromuscular medicine. The places you will rotate through include the VA, Cincinnati Medical Center, Cincinnati Children's Hospital, Neuroscience Institute. The good thing about this is that all of these places are actually within walking distance. So it takes only 3 minutes to go from the hospital to the Neuroscience Institute. It takes about 7 minutes to walk from Cincinnati children to the hospital and to the VA is about 10 minutes walking distance. Some of the perks for the fellow: you get the parking space, you get 2 offices, one in the VA and one in the neurology department across the hospital in the Stetson Square building. You have library access. You will get to take the AANEM in-service self-assessment exams, so you prepare for the neuromuscular and ABEM boards, and then you get expenses paid to attend one neuromuscular national meeting, regardless of whether you present or not. In terms of Cincinnati, Cincinnati is a nice city. The Queen City has 4 seasons, so if you are a fan of 4 seasons, this would be a good place for you. It has all kinds of things that you can do for fun. There is always something to do for everyone in Cincinnati. The webpage I put in there, it has more information, and if you have questions, I will be more than happy to answer. Questions, please email me or the program coordinator. I put again the webpage for the program and also the link for more information about Cincinnati. Thank you very much.
All right, programs, thank you very much for all your presentations. We do appreciate it. So it looks like there's a couple questions out there. Okay, one of the questions which we really like to hear from are the fellows. So for the fellows who are on the call, can you comment on what you have enjoyed the most about your program?
Sure, I can say something. I'm Karan Sani. I'm a fellow at University Hospitals, Cleveland Medical Center, in association with Case Western. I did neurology residency at University Hospitals, and I chose to stay. My mentors are, I think the highest of them there are not only fantastic in educating, creating a role model whom we can follow for, but are really personable and become like family. It's a very collegial atmosphere. It's a very friendly atmosphere. It fosters learning. It fosters creativity in medicine, and you get taught by world leaders who literally wrote the textbook on the subjects that you're learning about. And so it's been a fantastic journey with them thus far. And for me, they're always going to be part of my life, regardless of when I leave the institution. So thank you.
Hi, I'm Preston Eibling at Cleveland Clinic, fellow here this year in the same city as my colleague just spoke. I've really enjoyed learning here at Cleveland Clinic. The faculty is very supportive in every direction. I find neuromuscular to be a very exciting field and very challenging, but I feel that we're at the front edge of exploring how to treat these conditions and diagnose them. So I feel every day more equipped to take on the challenges that neuromuscular can give us in multiple ways. And Cleveland's been a really good city despite the COVID challenges, and the staff have been very supportive and flexible, asking us questions and guiding us as we bring multiple questions a day as we work with patients and also in the lab. So I've really enjoyed working with the faculty and my co-fellows, I'm sure would agree.
So we do have, let's see, another question is, do any of the programs have weekend call coverage?
No, for OSU, we don't have coverage for night or weekend for the neuromuscular fellow.
Same
Some
thing
of
for us.
the didactics might happen on a Saturday, but it doesn't really, it's not more than an hour.
At University of Cincinnati, we do not have calls on weekends. We don't even have also any education on weekends. So typically weekends are a free time for fellows.
Same here.
Same thing with us. We really never had. It's technically an 8 to 6 job. Monday through Friday.
Well, one of the questions that we have been asking from you program directors and fellows, whoever wants to answer, is can you tell us what drew you to neuromuscular medicine? I mean, why would they want to choose neuromuscular over some other specialty?
I think I have alluded to this in the opening of my presentation, is that one of the reasons neuromuscular nowadays is such a hot area. It's exploding with progress in both diagnosis and treatment of diseases. So I think previously, when I was a fellow myself, things were not the same. We didn't have the same approach to diagnosis or treatment. We did not have many treatments available. Now the field is exploding. So this is a very exciting time. In fact, outside of COVID nowadays, is whatever is happening is probably related to advances in gene therapy in neuromuscular disease, which is fantastic.
Just want to add that this is, sorry, go ahead, Bakri. I just want to say that neuromuscular is still one of the very few neurology subspecialty that require actually an examination. And we're actually proud that this is really good. Other subspecialties, unfortunately, have fallen into imaging and history taking and things like that. We're still challenged every day by every exam. So I think it's still, if you like neurology, if you like the neurological exam, and then after that, the testing that comes after it, neuromuscular, I would say it's still one of the best. If you really want to just sit against imaging or make decision on video, then you can go to other subspecialty. That's what I tell people. If you really like to tap and reflexes and examine and figure out which muscle is weak, and is it segmental or is it peripheral nerve, that's neuromuscular. So, and I think most people have gone to neurology. They gone to neurology because they like the neurological examination and the thinking process that comes after it. And unfortunately, some other subspecialties in neurology are losing some of that. We're probably still one of those who are going to never be able to lose that because that's how, because the neuromuscular system is so vast. So in addition to the new development and treatment, I think it's still, you got to examine the patient, you got to take the history, and you got to, every case is a challenging case, really. And every case is more fun than the other. Sorry, Bakri, your turn.
No, I think I totally really agree with what you and Hani said, and it just hit me as I remember John Kissel many years ago. I won't say when I told him I want to go into neuromuscular, and then he looked at me for a little bit and he said, "You're sure?" I said, "Yes," and he was saying is like, neuromuscular at that time was the bottom of the field. And it just tells you what Hani was mentioning is how the field blossomed, and absolutely. So the skills is really those skills of hands-on examination, localization, and what's really more beautiful nowadays is really we have the tools. In the past, when we do genetic tests, it was whether you buy a new car or you do the genetic test. And because the genetic test will cost $15,000-$20,000, and now things are really different where you're able to have those tools in your hand. And not only that, as Hani was saying, it's like really, I believe neuromuscular diseases, the code is broken in terms of we figured out the code in terms of those genetic diseases. And Surabhi's already made it to the clinic, and there is just going to be more coming down the road. So it's a blossoming field. I don't see a better time for anybody to get into neuromuscular more than now. It's just going to be exciting and very interesting over the
best of times.
next few years.
if I may add, I think yes, the advances in the field sells this more than anything else. Look at a video of those SMA kids doing things that was never ever documented before. I think would bring tears to the eyes. I've seen people cry looking at that at big meetings. So I think it's definitely exciting because we're really at the frontier of advances in neuromuscular. But you know, somebody asked me this week, one of our residents, and I said something that was spontaneous, but I thought profound. I said, you're called a neurologist, not a brainologist, right? And that's for a reason. I think to do neuromuscular, to me, is a big part of it is completing my identity. When you spend your time in residency, the truth is you do spend most of your time learning about the central nervous system. And if my car was broken down and I went to a mechanic and all he could do is tell me, well, it's not the engine, and he says, well, good luck with that. It's a non-engine problem, but here's your broken car. That probably wouldn't be as satisfying as somebody who knows, hey, I could tell it's not the engine. I actually think it's the rotors, and I have a plan for that, and your car will be up and running by tomorrow. I think, you know, it really is about completing the task to which you had signed up for being a neurologist. And I wouldn't choose another field because what brought me to neurology was, as we heard, the beauty of the detective work that's helped out by the physical examination. And again, you know, we're called neurologists, not brainologists.
I was going to add that one of the things that I really love about my week schedule is that each day is a different day. So even though a patient referral may say numbness or weakness, that could mean so many different things. And like the other program directors have spoken, it really relies on good history taking, good examination skills, and then using the additional testing to come to a diagnosis. And I think the other thing that I really love about being a neuromuscular neurologist is the fact that there are times where we're doing clinic, there are times where we're doing procedures, and all of those things interface with each other. So there's a lot of variety. There's a lot of breadth in this field. We're still discovering so many things, and we still have so many more, you know, newer entities coming into our field. So for example, those checkpoint inhibitor adverse events that have come onto the map over the past several years, you know, there's always things to learn in the field of neuromuscular. I think that's what keeps it very fresh and exciting for us.
Thank you very much.
And you know, we're a technology-based field, so technology only gets better with time. Look at ultrasound, for example. Certainly the machines I used 5 years ago compared to what I use now, just within that short period of time, very exciting. It's great to see technology drive so much. And when you think of robotics and augmented intelligence, our field is really ripe to capitalize on that. So it's just going to get better.
Okay, well, as we wrap it up, I just want to share with you a couple of upcoming events. The AANEM Spring Virtual Conference is coming up March 2nd through the 5th. So registration is open for that. Residents and fellows, just on a side note, you do get to attend that for free. So it's a wonderful opportunity to be able to go in and attend it. So that's wonderful. Somebody had mentioned the self-assessment examinations. So the neuromuscular and EDX self-assessment exams are May 3rd through the 10th. So thank you again for attending. We hope that again that we found this enjoyable and informative. And have a great night, everyone. Thank you.